Well, thank you very much, Michael, for that introduction. I would also obviously like to extend, I was going to say a warm welcome, but I think that's probably inappropriate given the weather outside, but certainly it's warm in here, so I think I can probably still offer you a warm welcome to today. Before I begin, I would like to acknowledge the Kaurna people as the traditional custodians of this land and to pay my respect to their elders past and present. I'm obviously very pleased to be here as the Chair of the Board, as you've heard, of the Australian Commission for Safety and Quality in Healthcare, to participate in launching the End-of-Life Essentials Education for Acute Hospital programs. The End-of-Life Essentials has had quite a long gestation in a way, but it's important now that we are seeing the introduction of these online educational modules which were developed from the Commission's National Consensus Statement, Essential Elements for Safe and High Quality End-of-Life Care. Now, not surprisingly in this area, the consensus statement had the ability to be able to be endorsed by the Australian Health Ministers in May 2015, and the Commission encouraged the use of this information to be the basis for further work to improve the safety and quality of end-of-life care in the acute setting. Not recognising the needs of people at the end of life is a safety and quality issue which can have profound impact on the experience of patients, families, carers and communities. These are complex issues, there's no question about that, and barriers that contribute to these issues being recognised have often persisted within the acute care setting. I think one of the things that often surprises us is that the majority of patients die in acute hospitals. And I think that's really a sobering thought in many ways, but I think the other important thing is that the acute hospital systems are generally designed to offer rapid diagnosis and treatment with a view to cure and discharge of the patient. So the philosophy of our acute hospitals Australia-wide is really quite different, yet as I said, the majority of the Australians do die in this acute hospital setting. And so unless we're well aware of this can mean missed opportunities for people to be engaged in planning for their own care and also contribute potentially preventable distress for patients and their carers and family members. The consensus statement highlights opportunities to improve end-of-life care both for people who are likely to die within hours or days and for those whose death is not expected to occur for a number of months. The need to place patients, carers and families at the centre of care is at the core of the consensus statement. And as I said, in an acute system, I think sometimes we forget that the patient has to come first. The End-of-Life Essentials Education for Acute Hospital programs provides online learning and implementation of resources to help build the capacity of health professionals working in Australian hospitals. And I hope to think that not only in Australian hospitals, but in other jurisdictions around the world where I'm sure some of the deficiencies are the same as ours. These documents are relevant for doctors, nurses, allied health professions in any acute hospital. The e-learning modules will help professionals build on their individual expertise, and we've heard about the significant expertise that obviously exists already at the Flinders Medical Centre and the university. But it really is across a whole range of issues that are fundamental to safe and high quality end-of-life care in hospitals. There will be, as you know, 6 end-of-life essentials online and education modules that are free to use. They can be accessed on the internet anywhere in Australia, and the first 3 of these are to be launched today. The End-of-Life Essentials online education modules will undoubtedly be a valuable tool for health professionals and services to use and to make real improvements to the end-of-life care that patients, families and carers receive. The identification and care of patients at the end of life is an important quality and safety concern, I believe, for all hospitals in Australia. Improving end-of-life care is an important priority for patients and their families in these acute settings. On behalf of the Commission, I would like to congratulate the team from Flinders on producing these modules. Turning a consensus statement into action. It's turning a statement into action. And really, this needs to be all about action. Thank you all that were involved in this process, which I believe will make a very important difference to people dying in our acute hospitals.